Good morning and welcome back to my channel. Today we will learn the most important MCQs which were asked in 2023 paper of AIAPGET Homeopathy. So let's start with the questions today. First question is, given below are two statements. Statement 1, a labor is called precipitate when the combined duration of the first and the second stage is less than 6 hours. And statement 2, precipitate labor is common in multipare rapid expulsion is due to combined effect of hyperactive uterine contraction associated with diminished soft tissue resistance. The options for this question are option 1, both statement 1 and 2 are correct. Option 2, both statement 1 and 2 are incorrect. Option 3, statement 1 is correct but statement 2 is incorrect. Option 4, statement 1 is incorrect but statement 2 is correct. The right answer for this question is statement 4. Statement Option 4, statement 1 is incorrect but statement 2 is correct. Option 4 is the right answer. Question number 2 for this exam was, which of the following chapter of the Kent's repertory you will find rubric coffee amelioration? Options are A. Mind, B. Stomach, C. Mouth, D. Generalities. The right answer is D. Generalities. In generalities, we will find food, amelioration, coffee. Now question 3 for this exam was, the most common cause of female infertility. First option, ovulatory dysfunction. Second, tubal disease. Third, uterine factor. Fourth, cervical factor. The right answer for this question is ovulatory dysfunction. Option 1. The most common cause of infertility in female is ovulatory dysfunction. Okay. Now question 4 for this exam was, in Kent's repertory, which chapter have rubric freckles? A. Skin. B. Generalities. C. Nose. D. Mind. Choose most appropriate answer for this. Option 1 is A and B. Option 2 is C and D. Option 3 is A and C. Option 4 is B and C. Now right answer for this question is option 3, that is A and C. In skin and nose, we find the rubric freckles in Kent's repertory. Now question 5 for this exam was, commonest position in vertex presentation is first LOA, second LOP, third ROA, fourth ROP. The right answer for this question is option first, LOA, that is left occiput anterior. Question 6 for this exam was, match the list 1 with list 2. List 1 contained rubrics and list 2 contained chapters in BBCR. Now the right answers for this is A. Homesickness. It is found in the chapter Mind of the BBCR, that is third one. Now lubricoids, it is found in the chapter Stools of the BBCR. Rubric ebullition, it is found in the circulation of BBCR. And rubric epilepsy, it is found in the chapter Stools of the BBCR. Question 7 for this exam was, which of the following is not the long-term risk for PCOS patient? PCOS means polycystic ovarian syndrome. The options were diabetes mellitus, second dyslipidemia, third hypertension, fourth miscarriage. The right answer for this question is fourth option, miscarriage. That is, miscarriage is not the long-term risk for PCOS patient. Question 8 for this exam was, match 1 with 2. Now in 1 there is placental. In placenta may develop as separate and nearly equal size disc. This is called as placenta bilobate. And B, one or more small lobe of placenta placed at varying distance from placental margin. This is called as placenta succinated. This is called as placenta succinated. Then C, such types of placenta is due to smaller coronated plate than the basal plate. This is called as placenta extracoriolis. And fourth one is develop due to missing of the central portion of the placental disc. This type of placenta is called as placenta fenestrated. Now question number 9 for this exam was, what is the correct sequence of hormones secreted during menstrual cycle? A. GnRH, B. FSH, C. Estrogen, D. LH, E. Progesterone. Choose the option. Option 1, A, B, C, D, E. This is the right sequence. That is, first GnRH is secreted, then FSH, then estrogen, then LH, and progesterone. This is the sequence of hormones secreted during the menstrual cycle. So the option 1 is the correct answer. Now question number 10 for this exam, AIAPGET 2023 exam was, vital force creates local affection in the chronic diseases. The options given are A. To diminish the power of internal disease, B. To cure the internal disease, C. To silence the internal disease for some time, and D. In response to antipathic treatment. The right answer is option C. To silence the internal disease for some time. Thank you. Jai Bharat, Jai Hind. Do like, share, and subscribe for more such videos. Next part of this series will be released soon. Jai Hind.